Hello, my name is Margaret Coyle. I'm a psychoanalytically trained psychotherapist and I'm based in the Adult Psychological Therapies team at Old Bridge House in Glendermot Road in Derry. If your unhappiness or your distress has brought you to see someone and the person that you see suggests that you might consider psychoanalytic psychotherapy, you'll want to know a wee bit about what that's going to be like. First of all, I'll just say some people talk about psychoanalytic psychotherapy and some people talk about psychodynamic psychotherapy. Really, there are more similarities in these two approaches than there are differences. So maybe I'll just talk about it as psychotherapy to keep it simple. So, psychotherapy can be helpful for a whole wide range of problems. It tends to be offered for people who are experiencing difficulties in how they relate to other people, or indeed if there are things that have happened to you in your childhood that are still causing you problems as an adult. The aim of psychotherapy is to try and help you understand how the difficulties inside our minds can get in the way of helpful change or progress that we would want to make. It provides a regular space, a space where you can come to reflect on your life as you remember it. It can help you understand and learn from your past in a way that helps you have choices for your present or indeed for your future. Your psychotherapist will be trained to think in a particular way about any of the problems that you bring, but the agenda will be set by you. They will keep an eye on the main reason that brought you to seek help in the first place, but they will also let you talk about what it is that's important to you at any given point in time. They will provide a safe place for you to reflect on your problems. They will help you practice a new way of dealing with your feelings, or indeed practice a new way of relating with another human being. It is hoped that by exploring your emotional problems or your relational difficulties, that you will learn from your past and your present. You will gain a better understanding of how your past is affecting your present, and in that then you will have choices to change or indeed to stay the same, but to move forward. So how long will this type of therapy last? Because the agenda is generally set by you, this tends to be a long-term therapy. It will take a long-term commitment from you. And the reason for that is to allow you the time that you need to gain the understanding that you feel that you've missed out on. At the end of the day, it will last as long as you need it to last. It will be dependent on clinical need, and it will also depend on the resources that are available in your area. And when you're referred for psychotherapy, you will be invited along to meet your therapist. At that first meeting, it is hoped that it will give you an opportunity to decide along with your therapist if psychotherapy is the way for you. It will be a joint decision between you and your therapist, but the meeting should give you some idea and some sense of what psychotherapy is going to be like. If at the end of that meeting it is agreed that you will engage in this type of therapy, then you'll be offered further appointments. These appointments generally are on a weekly basis. Individual psychotherapy tends to last 50 minutes each week, and you're usually seen on the same day, and usually where it can be helped in the same room, so everything becomes familiar to you.